I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. We're coming to you from the ANCOR conference. It's the American Network of Community Options and Resources. And our guest today is Karyn Harvey. Welcome, Karyn.
Oh, it's just a pleasure to be here.
So, Karyn, you and I got to know each other a little bit, and the work that you do in this field is really impressive. Tell everybody what you do.
Oh, that's so nice of you to say. Thank you. I'm very passionate about treatment and therapy for folks with IDD. I think it's a terrible health inequity that folks don't have access to therapy and treatment. It's unbelievable.
So
unbelievable.
When you say therapy, you mean for behavioral health, mental health type issues, right?
Mental health.
Okay.
And so many years ago, I started to realize that a lot of the behavioral issues that I was seeing were really symptoms of post-traumatic stress disorder. Mm-hmm. And that was riveting to see that people were being blamed for being manipulative or being attention-seeking, when really they were showing us their pain, and they were literally suffering from post-traumatic stress disorder from so many of the traumas that they had, was just eye-opening. And I had gotten it wrong. I didn't get it right away.
We all have at some point, so.
I really do. I seriously did. And I didn't get it. And, I wrote behavior plans. We looked at, how can we reinforce an alternate behavior? What can we do? And I started to realize, people are really suffering. And that's when I went back to school and to just be able to supervise people to do therapy and do the therapy myself. And so I started working as a clinical director in a large agency. And we heard one trauma story after another. Sexual abuse, physical abuse, just so much trauma from institutionalization, from bullying, from being excluded.
Yeah, sexual abuse, you mentioned that. People with intellectual and developmental disabilities have about a 7 times higher chance of being sexually abused. That's exactly. A statistic. It's an ugly statistic, but not a lot of people recognize that. And you mentioned, all different types of trauma and institutional trauma. One of the things that I think we've worked towards that's been very good over the past, 30, 40 years is moving people out of larger institutions into community-based settings. But maybe we didn't always recognize some of the trauma that they experienced in institutional settings that affects, maybe can even affect their ability to be successful in a community-type setting. But that sounds like that's right where you come in, right?
So misunderstood. So many people were so misunderstood. And that statistic about sexual abuse, I bet it's low.
Yeah.
Because those are the people, right, who call the police.
That's right.
Who reported.
That's right.
Those from the Bureau of Justice, they reported it. I'm sure you and I both know lots of people who never reported, right? There's just so much that goes on. Yeah, it's such a critical issue. And as you say, folks who are institutionalized for years, abandoned by their family based on the doctor's advice, right? And I work with a number of people where, we talk about their non-compliance, or they didn't want to take a shower, or they wouldn't eat slowly. Well, they were hosed down every night, stripped naked, lined up and hosed down, many of them.
Those stories are really hard to hear, but those stories happened. Those things happened. And, sometimes we forget where we've come from in this field. And maybe we wonder why, like you said, someone might be non-compliant with taking a shower when that's their experience that they grew up with.
Exactly. It's horrible. Or, they're stuffing food, eating too fast. Well, they had to fight for their food. They never even had their own place setting. Mm-hmm. The other thing that I see in terms of institutionalization is a number of folks transitioning who had maybe a residential placement and were really traumatized there because there were restraints used over and over again as part of a program. Seclusion was used. I've actually consulted with several agencies where they had folks from the Judge Rottenberg Center who were shocked. And so some of the people coming to us as transitioning youth coming into the program as adults have that trauma history based on really still institutionalization.
And trauma is a part of many people's lives, not just people with intellectual and developmental disabilities. And recognizing a person's trauma has become kind of a field in and of itself, I would say. And I think you've had a lot to do with that, in particular for people with intellectual and developmental disabilities. I think the term we use is what? Trauma-informed care, is that?
Yeah.
Yeah.
Well,
tell us a little bit more about that and what that means, and what you do in that space.
Oh, thank you for asking that. And I've been calling it trauma-informed support.
I like
because
that.
I love
Sure.
right, because we want to be aware that people have been through so much, but we don't want to have that mode of caregiving or caring for them.
Mm-hmm.
We want to help them to step into the present and to have the richest, most fulfilling life possible. But that sometimes really requires therapeutic supports.
Sure.
And people need treatment. And often people don't have access to that. And people, most of all, they need caring staff who are able to not be a caregiver, but more of a coach, right? Where they can support them in making friends that are unpaid, in maybe having love and love connections that help people to heal.
You know, just to expand upon some of the terms you used here, you said making friends that are unpaid. And that's something we don't think about. How many friends in our lives are paid to be there with us? None?
Right.
Yeah. But for so many people with intellectual and developmental disabilities, their friends are paid supporters. And so what you just said is helping people to make friends naturally, organically, and being a part of society and being integrated and having opportunities that we all have, because we all would like to have friends that aren't necessarily paid to be our friend, right?
Exactly.
Yeah.
And having significant others who aren't paid.
That too.
And people are told, well, you're probably never going to get married. You're never going to have kids. What kind of a life is that? You're starting off being told that, oh, that's not for you.
All the things you can't do.
That's not okay. No. Everybody deserves that. Yeah. The Harvard Men's Study showed us that relationships are the most important factor in terms of happiness and fulfillment.
Couldn't agree more.
And people are lonely. People are isolated. I think that's our biggest problem.
You can be around a lot of people, but still be quite lonely, can't you?
Exactly.
Yeah. So tell us some of the things that you talk about when you give lectures on this topic that move people or help people understand that mindset, but really help them move out of that mindset to support people in positive ways.
Oh, thank you. Well, I talk about 3 factors, and this is what people need to heal. Number 1, they have to perceive themselves as being safe. If someone has had trauma, if they don't feel safe, they're going to keep re-experiencing that trauma. It may look like behavior problems, but it's really because they feel threatened. The best defense is a good offense.
That's right.
Or they feel afraid, so they're going to run or hide because they're not feeling safe. So number 1, we have to figure out how to give people supports in a way that they feel emotionally safe. And I think a lot of that has to do with just reassurance and with really giving support to quality of life and, just having a respect and listening to people. So that's number 1 is safety. Number 2 is connection. People need, again, unpaid relationships. People need lots of relationships and lots of connections. So much research is out now showing us that relationships are a big piece of healing from trauma, right? It's important.
Sure.
And when you're isolated, you end up re-experiencing your trauma. And that's where staff being a coach and helping with social skills, helping someone invite someone over for dinner or go to the movies with someone, not somebody they live with, but someone they'd like to have a relationship with that they choose, can help in so much in healing. And then finally, empowerment, a voice that's heard,
Yeah. People need to be heard. Yeah. You mentioned these behaviors that we might see. We call them behaviors or adverse behaviors. And so many times, people who don't have that deeper level of understanding might just say, oh, well, they do this just because they have a disability. And I would say that that's rarely the case. Sometimes there's an underlying health condition, an underlying medical condition that's causing pain, but sometimes there's an underlying trauma, emotional abuse that they've been through, and that's their only way of expressing that type of pain as well. And recognizing the things that you've come to recognize, and learning how to support people in a way that can help that person, I guess, I don't know, for lack of a better term, work through or resolve some of those issues, or at least have them be less impactful to their lives, has to be very rewarding.
Well, I'm trying. I'm trying, and I know I've learned basically about 99% of what I know now from the staff who get it.
And that's what I'm kind of leading to is not just rewarding personally for you, but for the staff that work in this field and the impact that they can have on people's lives. And you help them to learn how to do that, which is, of course, rewarding in itself. But one of the purposes of this podcast is to help people understand this field a little bit more and see it as a viable career option. And I think, it's really nice to have a job that pays, because we all have bills to pay, but it's really nice to have a job that is personally fulfilling and rewarding as well. And you can truly impact people's lives in this field.
I'm so sorry. I kind of got the question a little wrong. You're so right.
No, I don't think I said it the right way, but
Yeah. The most rewarding thing is supporting somebody and seeing them heal, right? And really the critical factor is the staff. And the people that have healed the most that I've known in 37 years of working in this field, working inside of agencies, are the people who had staff who are really able to support them, who gave them hope, who gave them, a vision of a better life, who supported them in making friends and relationships, who helped them to just discover themselves.
Yeah.
You know?
And one of the things we know in this field are direct support professionals. The pay is not where it needs to be, for sure. And there are other types of jobs that they can find and make as much or more money frequently, but they're not going to necessarily offer the opportunities for this type of personal fulfillment.
Well, that's the thing.
Yeah.
And that's why I will never leave this field. And the reward just of seeing somebody blossom, seeing someone who's been hurt, who's afraid, who's shut down, start to trust, start to open up, and then move forward in their own life, that money can't buy, right? Money can't buy that. That is the greatest thing on the planet.
In our conversations prior to here and here, I've learned so much from you, and I know that we're probably, in making others want to learn more about what you do. And I think there are ways they can do that. In particular, you have a couple of books out, or more than that. Tell us about your writings.
That's so nice of you to ask me that question. Well, I've written 3 books. My last book, Trauma and Healing, just came out a few weeks ago.
Congratulations on that.
Thank you. It's got lots of materials that can be used on every level. So it's designed that the DSP can use the materials. I have workbooks, I have exercises, but I have a bunch of stories that people can read with the folks that they support. And questions, discussion questions, poems, all kinds of things about topics like losing a parent, or not getting a job, or losing a job, being bullied, having a girlfriend, losing a girlfriend or boyfriend, all kinds of issues that you can look at and say, let's read this story together, and let's talk about it.
Yeah. What other books do you have?
So, thank you. Trauma-Informed Behavioral Interventions. And that book is, I just look at all the sources of trauma for folks with IDD and all the ways in which we can support them in their healing, primarily programmatically, and where the DSP can make all the difference. So that book is largely, again, about the DSP, because for me, they are the critical people. They are the ones.
They're the front line.
That's it.
Yep.
Without them, we are
Yep.
nothing.
Yep.
But when that DSP gets it right, people take off. They blossom. They change. They become so fulfilled and happy. You know, it's not about, I love therapy. I believe in it. I'm dedicated to doing it. But therapy isn't what it's about. It's about who they go home to every day, who supports them every day, who believes in them. And that's how people really flourish. Then the therapy can help kind of be the icing on the cake.
Yeah. That's a great way to look at it.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. So, Karyn, one of the things that I always ask people and who are guests here is to give us 3 things in 3 minutes that you'd like the audience to know about that can impact this field, basically. But I'm gonna switch that around a little bit, because you mentioned 3 components earlier to trauma-informed supports, and I want you to just talk about those again, because I think I need to hear them again, and I think everybody else does too. And maybe talk about them in a way that it's things that people can implement in their everyday lives. So hit those 3 things again. I thought it was great.
Thank you. So the first thing is safety, but being emotionally safe. And that's all about words. And believe me, people who are non-speaking understand, right? IQ has very little to do with intelligence.
I agree.
People are smart.
Yep.
Positive words, kind words, caring words, and praising character, not necessarily behavior. You're a good person. You care about people. You're trying your best. You're amazing. Praising character. People rise to that and they say, this person's safe. I can be okay with them. And then they start to grow and move forward. So that's safety, first and foremost.
And even if you're not a direct support professional, you can create safe environments for people.
Everybody.
In every aspect of our lives, and including people with intellectual and developmental disabilities that you might see in other parts of your life. So safety.
That is so true. Connection. Having relationships. Unpaid, peers, friends, lovers, wives, husbands. It shouldn't be a big deal when 2 people with a disability get married. It should be normal.
You're right.
It should be normal. And this is where we need to go. It's a human right. Love and friendship. And then empowerment. And I say empowerment because we do have to hand over power. We have to just let go of any kind of power struggle. I'm going to control you. You're going to do this. You're going to do that. Take a step back and hear what people are saying. See them, validate them, move forward with them, supporting them.
Those are three wonderful things for all of us to think about and to work towards implementing in our lives, for sure. Great advice. Karyn, your passion for this is so clear. It's so evident. I think you're a pioneer in this field, and if ever you get a chance to hear Karyn speak, you should. Look for her books. Where can they find your books?
Thank you. Well, AAIDD has published the last two, and they've been wonderful.
Excellent.
And they're on Amazon as well. The first one, Positive Identity Development, is on the NADD website. So you can get them on NADD website as the first one, the other two on the AAIDD website and on Amazon.
Excellent. Karyn, thank you so much for taking the time to be my guest today, and more importantly, for the work that you do in this field.
I'm so honored. Thank you.
Bless you.
Thank you. Thank you for the work you do.